Good morning.
Yeah, mine's rather lengthy, so bear with me. So, last night we had a board meeting. Obviously, the biggest topic of discussion was the dump station. So, we've gotten a lot of work completed here within the last 2 weeks. So, Kenny's have started the dirt work. The tanks, all 8 septic tanks have been installed. They are set. Water line is been trenched to both of the dump sites. So right now, yeah, really we're waiting on some of the subcontractors. We need to get power run to both tank, both tanks, if you will, to run the float system as well as the alarm system. So as we're just kind of waiting, I've got the gate system. It's ready. So we obviously got to have power to get that installed. So I don't know for sure when we'll be up and running. Obviously Memorial Day is right around the corner here. It'd be awesome if we could be up and running by then, but a lot of factors, kind of weighing the timeline there. I have a job vacancy right now. I've kind of converted that position into a naturalist park technician position. We've had 15 individuals apply for that position. Pretty good turnout. We wrapped up interviews yesterday. We ended up interviewing 3. Hopefully by the end of the week, which really is tomorrow, I will offer that position to one of those individuals. So had some good candidates. Seasonal employee, we have offered a position to a local young man. He's going to be working for us probably towards the end of May through August as seasonal help, which is greatly appreciated. Last month I reported that we had applied for AmeriCorps team. We were accepted for AmeriCorps team, and unfortunately our government has kiboshed the AmeriCorps program, so we will not be getting a team of AmeriCorps this year, which is rather frustrating for myself and my staff because we had a lot of projects lined up, materials purchased for them to do the work. Gonna kind of push us back timeline wise for a lot of these projects. Let's see, we hosted a volunteer banquet last month. We handed out, so if you don't know, a lot of our programs, our nature center are run by volunteers. So next week we are hosting Pioneer Days, which has been a long event. I remember as a kid attending Pioneer Days at Oakland Mills. It's a 3-day event, and without our volunteers we wouldn't be able to have those events. So we hosted a banquet. Milestone award we gave to Sandy Brazil. She has donated, volunteered 20 years for our department, mainly taking care of our animals, our fox, owls, raptors, if you will. So 20 years. She would come in nights, weekends, holidays, during snowstorms. She's been a great asset to our department. Mike Messer, outstanding contribution. He volunteers multiple times a month, takes time out of his Saturdays to keep our nature center open, and he's been very instrumental in our rock display that we have in the nature center, showcasing a lot of fossils, geodes from the area. A good portion of that area and rock specimens, if you will, come from Iowa Wesleyan campus. So volunteer of the year, Ike and Kitty Meek. They have been great the last 2 years, helping cutting and splitting firewood and taking it directly to the campgrounds. One less thing Dalton and I have to do. And lastly, the disc golf club here in Mount Pleasant. They've been a great asset. Obviously we have 2 disc golf courses, and they have done a ton of work. They've clocked probably, as a group, well over 1,000 hours this past year in maintaining and improving our disc golf areas. Nothing really new on the playground. We're still hovering about that 50,000 mark that we've raised thus far. Gloria has sent out letters to area businesses seeking donations for that. Our total cost for the project is about $293,000. So we've got $50,000 thus far. The playground company we were working with, they are giving us $95,000 as almost a match grant, which is great. So we are way closer than I thought we would be at this point in time. So really, other than that, we had a board meeting last night. So obviously talking about raising our rates, we will be raising our camping rates. They have set some prices that will be effective immediately once we get the dump station open. Working with the chamber to do a ribbon cutting for this project. At that point, we'll do a press release indicating what our rates will be moving forward. So a lot going on. Busy time of the year for us. So any questions?
Yeah, just a couple. So, access to the dump station, how's that facilitated?
So we're gonna have a gate. You will have to be a registered camper to dump there. So, and I can just kind of briefly highlight. So right now it's $20 for any camper to come in and camp. Well, that's with the online reservation. We're gonna bump it to $25. And then and I don't know why it was done this way. It was done prior to me, but it was $25 or $20 for the online registration fee and $15 for walk-ins. So my board last night decided it's going to be a flat rate across the board, whether or not you walk in or pay online. It's going to be $25, and the dump fee will be associated with that or incorporated in that cost. If you're an outsider just passing through and want to dump, you're going to have to pay $25 to dump. So more or less, we've got to recoup, get the revenue to offset the pumping cost. That's the only way that this is going to work. Like I've been preaching ever since I started, the $2 honor system was not working. The amount of money that we were paying somebody to come and pump, we were in the hole. Because I know the summer that we had to close the facility, I had it pumped 12 times at 400 and some bucks, a pop. It wasn't working. That summer we pulled from middle of April through middle of October, we pulled $19 out of the registration box. That didn't even pay to run the pump. So, we're going to have restrictions. It's unfortunate, but, county taxpayer money is paying to pump this out. So we've got to, generate revenue to offset that cost. And that's what we're going to have to do moving forward. So, if you want to dump, if you're an outsider, you're going to have to pay the $25. That's what the board come up with last night. So.
Firewood down there, is that a cost? Right?
It is, yeah. So right now it's $3 for 6 pieces of firewood. That's probably going to be increasing. That's a pretty good deal. And I've kind of looked at our rates, across the board for shelter. Cabin wise, we're right in the ballpark. Looking statewide, definitely I feel that we have some really nice cabins, and I've stayed at, other cabins across the state operated by county conservation departments, have a pretty good feel of what they're charging, as well as DNR state owned facilities, and we're right in there. Camping fees, we're on the lower end. Looking at surrounding counties, for example, Big Hollow, they're about pushing 30, I think, 25 to 30, which I know for a fact that they're going to be increasing here. They have full hookups and Wi-Fi. We've looked at trying to get Wi-Fi. We're a little bit restricted given, the area, being in a floodplain, down in a low spot, but just trying to, improve our campsites to make it more accommodating and for the public. So, any other questions?
Thanks. The internet thing, I thought we talked to Derek about looking at.
Yeah, and I haven't heard back. I can follow up with Derek on that. I know they've ran, fiber
I know that-
through there, so we could possibly, but I know last time I talked to him, we were under a contract with Lisco. And I don't know when that contract, when it expires, so I think that was the biggest concern, I think with Starlink that come through. So we couldn't breach the contract, obviously, if we were to go with Starlink at that point, so I can follow up with Derek on that.
Thank you.
Yep.
Thank you, Caleb.
Yep.
I missed the approval of the minutes, my mistake. We have May 1st and May 6th minutes. Everybody's had a chance to read them?
Yes.
Motion to approve one or both?
Yes,
Both of them?
both.
I'll second that.
Any discussion?
No.
If not, all those in favor say aye.
Aye.
Aye, opposed, none. Next on our agenda, if I make sure I follow it, Katie.
Sure, thanks. So the Board of Health met last on planning to meet again next week in the Public Health Conference Room. It's on May 14th at 12:30. Most of our energy right now has gone into following and preparing for the measles outbreak. That continues to spread, and we have over 900 cases nationwide. It's in over 30 states and has also spilled into Mexico. Thus far, there have been 3 deaths, and 2 of those were children. 96% of the cases, though, were in unvaccinated individuals and people whose vaccination status was not known. And since we last met, the state has expanded funding for measles vaccinations. So measles vaccinations, the MMR, is now free for anybody in the state of Iowa, regardless of insurance. So if you're insured, uninsured, Medicaid, it doesn't matter. The state's offering it for free. We have this available at Public Health for adults and children, and it's our normal immunization hours. If those hours don't work for folks, we are definitely willing to work with people to get them in. I was absent last week because I attended the Preparedness Summit that was in San Antonio, Texas. That was paid for through our Public Health Emergency Preparedness Grant. We were able to send, we have a 16 county coalition, and we were able to send 3 individuals plus our grant coordinator to that. So they chose someone from a large, mid-size, and a small county. So we were the small county. We have Morgan Francie, who'll be coming on next month. She's filling a vacancy that was left when Amy Martin left. Kelly Carr presented last month at the Noon Rotary, and we have some upcoming events. We have our Stride into Summer event that's held annually at East Lake Park. That'll be on June 1st. Healthy Henry County Communities puts that on. And then Angie Rum and I are hosting Walk with Ease. That begins on May 12th. That's Monday. We're partnering with the Rec Center this time on that. And we offered it back in January. It was really well received. It is a 6-week walking program for people with arthritis to help improve mobility and strength. And that the training and materials for that is from the Arthritis Foundation. That was also free of cost for our department. We facilitate the classes. Public health office hours continue monthly. Those are attended by county administrators, and Dr. Cruz and Ken Sharp from Iowa Health and Human Services host those. Most of the discussion this month was surrounding funding and changes in funding, and the state unfortunately doesn't have a lot of answers as to funding cuts from the federal level, but they do keep us informed. One change that was made is the Early Childhood of Iowa. The changes to that program are being pushed back. They had redrawn districts for that, and it's just been more administrative work than they could handle. They were hoping to make changes to that by July 1. I don't know when that will be rolled out completely. We had a rabies refresher last week. That was through our state veterinarian and our field epidemiologist. Public health is responsible for following rabies or animal bite cases, and we do recommendations for individuals and healthcare providers on post-exposure prophylaxis. That is quite costly. So that's something that we have refreshers on frequently. The other thing that we are working on is a meeting with the Iowa Cancer Consortium. So Iowa has, I'm sure you guys have heard, the second highest cancer rates in the nation, and our rates are rising. So there has been a push by the Iowa Cancer Consortium to do this 99 counties project, where they're actually setting up town halls in each county, and we're trying to get that set up for June. Kelly Carr and I are working on that, so we'll keep everybody informed. It's kind of a hybrid meeting where there's some in person, but folks can also join online. We hope to get members of the public, healthcare providers, anybody with some skin in the game. And then the last thing I want to mention is that it's Nurses Week. So if you have not thanked your nurses yet this week, it's May 6th through May 12th, and you still have a little bit of time.
Yes, I have, thank you.
Katie had a couple of little questions. So
Sure.
you mentioned the rabies thing. Do we have any cases in Henry County?
No. We are required to follow any animal bites though. So, the vast majority are dogs, but I mean, it can be anything. If people find bats in their home, that's a common one that we have to follow. And it's kind of interesting because we can actually send animal specimens to the state hygienic lab for testing. The reason we get so wound up about it is it's deadly. We have had human deaths, not in Iowa, but in the nation. There was one in California last year. I believe there was one in Minnesota as well. The one in California was related to a bat. But any animal bites we have to follow, and then we have to recommend post-exposure prophylaxis. So that's a series of injections, and it is extremely costly. I think estimates were anywhere between $4,800 and $6,000 for the medication itself. That's not for like any medical care appointment. So that's not something we carry at public health. Cost-wise, that would not be feasible. If folks call in with animal bites and need post-exposure prophylaxis, the emergency room here is where we typically have to send them. It's not something any of our pharmacies carry either. So.
Good.
When you said bad in-house, I mean, bad in-house doesn't necessitate a testing of that critter, right? It
It depends.
I've had bats in my house before, and you catch them and throw them out the window, out the
Right,
door.
it depends. So we have an algorithm that we follow as far as what animals would need to be tested. And the thing is, if you have a child that's not able to tell you if they've been in contact with the bat, or if you have an unconscious or sleeping person in the room where the bat is and you can't verify that that person didn't come in contact, we do have to test and offer post-exposure prophylaxis.
Can't we have any bites on your neck?
Maybe that's what that was. So any bites, suspected bites, possibility of bites.
Any contact with saliva, yeah.
Well, hey, I pulled this up just so you could see this. I don't know if you've been talking with Kelly on this or not, but our interactive calendar that we're trying to work with on the website to make it more user-friendly and interactive. So we pulled yours up there, and Kelly helped us with a link to get it to this area so that we can actually see when your next meeting is. So if people want to go, they can obviously have a little better visibility to when and where. Another thing that Southeast Iowa had asked me to work on with you guys is, I don't know how to do this yet, I haven't talked to Kelly, is to get more visibility to C-Bus, make sure that people are more aware of that capability.
Okay.
So I'll continue to work with them and see if they have some ideas to help us engage and make sure the community is aware of that.
Yeah.
Since we don't pay for that.
We do, and we also have resources available for other transportation options. There was Burlington Cab Service for a while, but it was so underutilized that they haven't continued coming to the county. But we have been in touch with those folks. We have a Care Links program, and that is part of it, is try to hook people to services like transportation.
Yeah, I pulled that up and looked at it. I talked with Mike Forrest about it a little bit, so he's aware of that. And I think maybe he and Kelly have had some conversations. It's always good to keep that in front of folks, so that that's another option. And it's not terribly expensive. It's like $30 to go to Iowa City, right?
Right.
So
I think it's like $250 in town. I have to check their most recent rates.
Yeah.
But
Yeah, so that's good. But any other things, and I talked to Kelly about this, so anything we can work with together to make that more user-friendly and interactive, we'll keep working at it. but if there's nothing right, let us know, obviously, but whatever she sees.
We try to keep ours updated. She's really good
Yeah, she's
about
really good at it.
keeping on top of it and making sure that the information on there is current and that the links still work is the other thing. We've had so many changes with links to the CDC website. Half of them that you go to no longer exist or they're broken. So that does take some work for her to keep up on that. And that's not her only role either, so.
I understand, but she's done a really good job of working with us.
Mhm.
Caleb, same thing for you with Gloria, she's helped us and we've been able to pull that in and make that work extremely well, so far, things are looking much better.